I'm going to present on cancer exercise program. So before I started working at Made Possible, I did my undergrad in Colorado, and the reason I chose to go to the University of Northern Colorado was for their cancer rehab center. I was really interested in helping cancer patients gain strength, improve their quality of life. So I'm kind of presenting on the idea of a cancer exercise program, like what goes into it, and then how we could kind of transition it to be here as well at Made Possible. So, a little bit background about the cancer disease itself. It's the second leading cause of death worldwide. 10 million people each year die from cancer, and about a third of those deaths are preventable, either just eating healthier, exercising, quitting smoking, that kind of stuff. And I found this really interesting. So a recent study, I think it came out in 2022, found that 90% of Cancer Institute hospitals that treat cancer do not have a link to any cancer rehabilitation services. 90%, that is crazy. A lot of the cardiac rehab, they have access to it. The percentage is a lot lower. And then a reason why there's not a lot of rehab could be due to a lack of awareness. A lot of times we hear about cardiac rehab, but we don't ever hear anything about cancer rehab. And the benefits that you can get from just exercising during, before, after treatment. And they're overly concentrating on just treating the disease. They're just focusing on the chemo, the radiation, nothing about their quality of life and their functional challenges they are going to have with the cancer and the treatment as well. These are some common cancer types that we would most likely see here if we started a cancer center. Lung cancer being the most common cancer, and then it's not on here, but pancreatic cancer is actually the most deadly. Breast cancer is the most common with women as well. So this is just kind of an overview of how exercise can help. So cancer survivors can suffer from a lot of physiological toxicities affecting the cardiovascular, pulmonary, musculoskeletal, immune, GI, and neuroendocrine systems. So a lot of the treatments affect all different kinds of our body. So many survivors experience not only physiological but psychological impairments as well, such as increased fatigue, depression, and decreased quality of life. So what exercise can do is directly attenuate to the toxicities of the cancer and the cancer treatment itself. And exercise can help lower the risk of reoccurrences and improve survival compared to those who are inactive. So there's been a lot of studies done on exercising through cancer treatment and how they're less likely to get breast cancer again or lung cancer again compared to those who aren't active during or after their treatment. All cancer diagnoses can benefit from a cancer exercise program, no matter what kind, what stage, how recent the diagnosis has been. Everyone can benefit from it. There's been overwhelming research supporting exercise to treat and prevent the negative physical and psychological side effects of cancer treatment. Again, before it, during it, and after it. So this is going to go into some goals and objectives of a cancer exercise program. Number one, increasing their quality of life, helping them feel better, sleep better, be able to go to the grocery store, be able to walk their dog, play with their kids, their grandkids, reduce depression. Depression and cancer-related fatigue are two huge side effects, psychological side effects that you see with cancer because of the treatment, but also because of the diagnosis as well. They don't know how long they have to live, just trying to improve their quality of life as well. As we know, when we exercise, everyone feels better. That's what we try and ask here when our clients leave, right? How do you feel after? How do you feel before? Making sure they know that this is good for them, this is going to make them feel better. Another goal is to enhance their muscular strength and endurance as well. Improve their balance, flexibility, and mobility. I'll go into this later, but a lot of cancer treatments, they impact and affect balance, neuropathy, the tightness of your muscles, your mobility, which as we age is super important to prevent falls, to keep you mobile. And another goal will help to transition patients and clients into a healthier and active lifestyle, help them gain confidence to be active and exercise on their own, and slowly introduce them to different nutritional strategies as well. So before you would have someone come in to a exercise session, you'd want to first do a medical evaluation, so get their cancer treatment history, how recent it was, what kinds of cancer treatments they've had, because if they've had chemo versus a radiation versus a surgery will impact what exercise choices you'll make, how far and fast to progress them. You want to just get their family medical history and their medication list because of the side effects they could have and how that might increase their blood pressure, if it would make them dizzy, that kind of stuff for programming exercises. And then, say the first time you see them, it's important to perform an initial physical evaluation just to get a baseline so you can see how they progress as they go. So wanting to measure their cardiorespiratory, especially with lung cancer being the most common, their muscular strength and endurance, their mobility, their balance. It's important for those coming in to see where they started and the progress they've made. I like to make it a point, and I know a lot of our coaches do, to show, right, you started chest pressing 10 pounds, now you're chest pressing 15 pounds for 12 reps, only in a month. How cool is that kind of thing? And just builds their confidence too, which will help with the depression, all of the side effects.
What do you use for cardiorespiratory? How do you evaluate it? What kind of your cancer rehab?
So 2 different ways you could do, you've heard of the VO2 max? So there's not the VO2 max test, but no. So it's just a modified version of that inclined test. It's slower pace basically.
What are you taking, heart rate, or are you taking
just heart rate and blood pressure.
Oh.
And then you can do, those spirometers that you can breathe in and out of to test the lung capacity, that too. So you could do the 1 mile walk test or something. For this facility here, we don't have access to a treadmill or med cart, so you can do the walk test, time how fast they do, how far they get in 6 minutes kind of thing.
Did you do anything for mobility or balance? Any specific testing?
Yeah, so for mobility we did the where you sit, reach for your hamstrings on the box. We also did, you took the PVC and you did this one where you tried to reach your hands behind each other. I think
measure the distance, or how do you?
Yeah, you measured the distance between their hands. I think we could also add in our own, we do the ankle mobility one, the wall angel one, just that shoulder this one, that kind of stuff. And then balance, I can't remember exactly what we did. I think we did a single leg stand just to see how long they could do it. Actually, it was a machine you were hooked up to. You had a belt, but it was a platform. First you had no shoes on, flat surface, eyes open, and then you closed your eyes, and then it kind of measured how much you wobbled. Yeah, and then they did a foam pad, and on the foam pad they measured that. It was some technology thing. I can't remember the name, but I could look it up for you. And then, so after the evaluation, you input all of that information, take into consideration their cancer type, what treatment they had, all of the information from the evaluation, and then you would break it up into 4 different components. And so this is based off of the phase program that I learned at the Cancer Institute I worked at. So first, cardiovascular exercise for about 20 minutes, strength training you want to get to all the major muscle groups and then incorporate balance, flexibility, and mobility into each session. And then, as I said, all exercise prescriptions are set at a certain level based on the cancer type, treatment, and physical condition.
Question real quick. Are you
Yeah.
going to go over how you treat chemo versus radiation?
Yeah.
Obviously.
So this is going into the phase program. So the phase program is 4 different phases. Phase 1 are cancer survivors who are undergoing chemotherapy and or radiation treatments or have a reoccurrence to cancer. Each phase is 12 weeks long. So you'll only be in phase 1 if you're currently going through chemo radiation. The goal of this phase is to just alleviate the side effects of chemotherapy and radiation treatment, keeping the training intensity very low, just wanting to get them to feel better after their chemo radiation treatments. Phase 2 are either those who have completed phase 1 or patients who have had surgery or a hormonal treatment. They have not had chemotherapy or radiation. So you can either enter the program at a phase 1 or a phase 2. So this phase, these treatments aren't as harmful to the body as chemo or radiation, so the training intensity can be a little bit more intense depending again on their cancer type. The goal, reduce physical, functional, and structural limitations created by the cancer treatment in a low to moderate intensity. Phase 3 are only those who have completed the phase 2, so 12 weeks in that phase, and that you feel like, okay, they can progress to moderate. They could do another 12 weeks in phase 2 too, just depending on what you think or how they're feeling. The goal is to improve physiological and psychological values beyond baseline. It's important to do both. As a coach, you're not only an exercise coach, but people spill everything to you. They just want to be your friend. They want to talk to you. They want to get things off your chest. Especially with a diagnosis with cancer, it's important to build up their psychological well-being as well. Another goal is to get them back to functional health after completing this phase. They can now move up to moderate high intensity, about 60 to 85% of their heart rate reserve or 1 rep max, which could be measured by like a heart rate monitor or Apple Watch or something like that. Phase 4, those who've completed phase 2, this is the last phase of the program. So it's, again, improving their physiological, psychological function, so improving their strength, wanting to see their weights go up. You might not necessarily see that in the phase 1, phase 2. They might just stay body weight. They might not even touch a weight. And then you're kind of trying to transition them into being able to do something as a group, like the semis we do here, or even encourage them to exercise outside of the facility themselves. And they can get up to a pretty high intensity after this, about 95% of their heart rate.
For the most part, phase 1 to 3 is one person, never in a group setting.
Yeah, phase 4 would just be when you introduce them to a semi, so kind of like here,
Gotcha.
like introducing them. So these are some very common toxicities, symptoms, side effects from cancer and cancer treatment, mainly chemo. So a chemotoxicity occurs with all kinds of chemos, different types. It causes cancer-related fatigue, which I'll talk about next, balance issues, weakness, and chemo-induced peripheral neuropathy, which I'll go into. So, has anyone heard of cancer-related fatigue before? You know what it is? So, it's different than your normal fatigue you'll get if you don't sleep or if you get sick. It's a combination of all of the physiological toxicities affecting the body that I talked about earlier, right? The heart, the lungs, the GI, muscular, and the brain. It's persistent sense of tiredness or exhaustion that is related to the cancer or its treatment. It's out of proportion to the level of recent activity and interferes with functioning, and it occurs without exertion. So they could wake up exhausted, not wanting to get out of bed, and it doesn't have to do with if they exercised the day before, if they slept well. It's just this persisting fatigue. And from the studies I've read, the only thing that really helps it is exercise, is after they exercise. They may not want to come in and do it, but once they're here, once they get moving, it's the only thing that seems to help, and it's very common with a lot of cancers.
Kelly has a client like that.
Yeah.
Yeah, there's a lot of clients we have that cancer.
Yeah, and it can last after the treatment too. It's not just during it. It can,
Lifetime, right?
yeah, it can last for a long time. And then chemo-induced peripheral neuropathy. Have you guys heard of neuropathy before? Yeah, it's common with like diabetes, right? So it's tingling, pain, burning in your hands, mainly your hands and your feet, loss of feeling, and then you'll get sensitive to the heat or cold, which is important to take into consideration when exercising too, especially in Florida. Although it doesn't get too cold, but even touching like cold metal things can be uncomfortable, so you have to pay attention to that. So now I'm going to go into like the differences in radiation and chemo and kind of how you'll want to adjust for both. So radiation there's two different kinds. I won't go into that, but basically it's a laser, right, trying to decrease the size of the tumor. It can limit your range of motion and cause your muscles to stiffen. And I'm not sure exactly. I know there's different ways on how doctors choose either to give chemo or radiation. I know they try to avoid chemo as much as they can. So I don't know where I was going with that, but so radiation causes your muscles to stiffen. So if you have a patient with radiation, you'll want to incorporate a lot of mobility work with the radiation. So say, for example, they had breast cancer, they had radiation to their chest. Their chest muscle, their shoulder is going to be really tight. So you'll want to incorporate a lot of mobility with that, which we already do with a lot of our clients because of we're like this all day, typing, sitting at desks, so we already do a lot of that. It's also important to do longer stretches and work on really breathing into it. They should do it more than just when they come in here. They should do it right when they start their radiation treatment. Manual therapy, so like either massaging it yourself or using like the lacrosse ball on the wall to help roll it out, help with the scar tissue, increase their mobility, range of motion. And then radiation can cause the induced peripheral neuropathy, which I have a slide on, and I'll go into more detail about what that is and how we can use it and work around it in a clinical setting. Hormonal therapies. These are more common for breast, gynecological, and prostate cancers. They can still cause joint stiffness, same as radiation, but exercise can help decrease the pain, the joint stiffness, and increase their strength while increasing quality of life. With hormonal therapies, because it's messing with your hormone levels, you have a higher risk of osteoporosis, which is why it's important to do weight-bearing exercises, not just swimming, not just walking, but helping them build their bones up using weights and that kind of stuff. And then pain and joint stiffness is really common with hormonal therapies as well. So going into chemotherapies and kind of how they affect the body and what exercise is going to do to help that. So in red is going to be the chemotoxicities, so what chemo is doing to the body, and then the green is how exercise is going to help that. So, for example, a chemotherapy like doxorubicin or Taxol, that's going to increase the resting heart rate, and exercise, as we know, helps decrease that. Chemotherapies can break down skeletal muscle. Exercise helps increase protein synthesis. It slows motor function. It can kill a lot of nerve endings, which is why you again get peripheral neuropathy. And then exercise helps improve neurochemical availability and increases motor unit recruitment. It decreases total lung capacity. And exercise can help strengthen your intercostal muscles, strengthen your breathing muscles, improves your ventilation. You lose your appetite with chemotherapy. A lot of people lose weight with it too, so exercise helps you feel hungrier the more you're moving, helps you build your muscle back too. And then chemo can also inhibit your bone marrow function, and exercise will help you improve your red blood cell production. Wrong one. So these are some special considerations for exercise and the different treatments. So if a recent client has a surgery, right, if they had a tumor taken out of their breast, they might have a recent incision on their side. You might have to be cautious of what positions you put them in, either laying on a bench, on the floor. They probably won't feel comfortable putting their chests flat on the ground or on a bench. Ports, that's more of like a chemotherapy, but it's still a surgery getting it in, but the placement of the port, being mindful of what position the client's in, if they're twisting and they feel the port being uncomfortable. Any pains with movements near the surgery area, changes with body image, especially with breast cancers, edema, so swelling of your limbs, and then extreme fatigue. And extreme fatigue is going to be a special consideration for all exercise, incorporating maybe more breaks. Radiation, during the treatment, they can get acute or chronic skin reactions just to that site. So they really need to be careful, they want to put lotion on at home, but just being mindful of that and positions they're in. Leukopenia is decreased white blood cells, so they might be more prone to infection. So making sure the clinical setting is extremely clean, everything's wiped down. With radiation, you get dehydrated, but nausea, vomiting, diarrhea are common side effects of that. Edema is again another side effect, and then the extreme fatigue. So chemotherapy, this one's the most intensive type of treatment. Leukopenia again, so being careful with like maybe wearing masks, cleaning.
What is leukopenia?
Low white blood cells. And then the thrombocytopenia, I think that's how you say it, is low platelets. Bruising is really common with chemo, nausea, vomiting, diarrhea again, dehydration, extreme fatigue, and then drug delivery and systems. So meaning what type of drug is how it's delivered. Is it a pill? Do they take it every day? When do they have it? What type of chemo is it? And then the symptoms from that specific chemo, because different chemos will have different side effects. Some affect the heart more, some will affect the muscles more. I know the ones with breast cancer, they're Taxol and Taxotere, they are more common to cause peripheral neuropathy. Well, I think the lung cancer one more is impactful on your heart, but I think they're still researching that. So lymphedema is a chronic condition both in males and females that causes swelling in either your limbs or your trunk, and is really common with cancer and cancer treatments. So what exercise can do to help this is increase the flow of blood and lymph fluid. Lymph fluid relies on the contraction of your muscles to move fluid around the body, and there's research that exercise in the water is actually extremely helpful in this because of the pressure from the water. I'm not exactly sure why or how, but there's been a few research studies on that. So I forgot to mention, but lymphedema is it's more common with like breast cancers, I would say. So you have a lot of lymph nodes located in your core, and then there's some, they're located throughout the whole body, but a lot are in your core. And so you're wanting to get those muscles firing, using them, and a lot of the times we don't use those muscles every day if we're just sitting around. So getting blood flow to those muscles will help the lymph fluid move around, decrease the swelling. So like pelvic tilting, doing anti-rotation exercises, dead bugs, hip thrusts, just to get the core working. So peripheral neuropathy, like I mentioned, it's tingling, numbness, weakness in your hands, fingers, and toes. You have sensitivity to the cold, to touch. And then it also decreases your balance because you don't have a lot of awareness in your feet anymore, because it's your nerve endings aren't firing, or they're misfiring, and that's why you have that pain, so you'll have problems walking. So if a client comes in with peripheral neuropathy, especially in their feet, it'll be really important to work on balance on different surfaces, making sure they take off their shoes, work on walking up and back. Depending on how bad their neuropathy is, some days they may not want to stand on their feet, so doing more seated exercises, doing the bike instead of walking, that kind of thing, depending on how they feel that day. So I have a picture of I guess it's called a neuropathy ball, but what it does, you can roll your foot on it, or you can roll it in your hands, and it helps kind of get the nerves firing to help get more sensitivity to your foot. So if someone has that, I would probably have them do that either as a warm-up or at the end of the session, just to make sure. I would encourage them to do it at home too. So as I mentioned, depending on the severity, if they have peripheral neuropathy, you'll want to incorporate balance exercises, light massage to those areas, because sometimes even just touching a dumbbell or a bench or a band will be really painful to them. So just lightly kind of trying to get feelings to their hands, their feet. Practice guided walking, biking as I mentioned, instead of walking, depending on how they're feeling that day. And then again, it's helping to stimulate the nervous system. So this is kind of like an example. If someone came in and they had peripheral neuropathy in their feet, what you could start with are laying down on the floor, just getting movement to their feet, doing ankle circles, either seated or on the floor. And then you can go into like toe, heel raises, depending on how they feel, getting blood flow to their feet, and then progressing to single leg balance. So now I'm going to go into just some specific types of cancer and some considerations. So starting with prostate and gynecological cancers, they can have bowel, bladder, and sexual dysfunction. So being mindful of them having maybe to go to the bathroom more. They might have what are those? Like the bag, like a urine bag.
Colostomy.
Yeah, I think so. So they might have that, so you might have to work around that. And if clients could have diabetes too and have that bag as well. Depending on the type of treatment and side effects, biking may be uncomfortable for them, so finding different ways to get their cardio in. And then incorporating, because of like sitting on the bike seat, depending if they had radiation in that area. And then Kegels, pelvic floor, core to help strengthen that back up because of where the treatment was. That portion of the body will be it won't be as strong, it'll be weaker. Considerations for breast cancer. So a lot of times it's common in breast cancer patients to not have as much abduction in the shoulder. They lose that range of motion. So working on this, working on scapular weakness, so working on opening up our shoulders, fighting against tightness in the front of your chest. So a lot of chest opening mobility and exercises. We have a few clients that have had breast cancer here. So a lot of the things they like to do is like on the wall doing a gentle stretch. They like to roll out with like a lacrosse ball on their chest. One of our clients likes to do this one too, where you kind of assist yourself to get up as high as you can and come back down, especially on that if they are struggling with that range of motion. And then scapular weakness is a huge thing we see not only with breast cancer, but it's important for everyone because we've found that out that a lot of times people aren't using those muscles and to help with their posture. And then some psychological aspects of cancer. So I mentioned in the beginning it's very common for cancer patients to go through a depression. So exercise can help not only motivate clients, but to thrive, not only to survive, but thrive. So exercise can help reduce anxiety, improve depression, reduce their cancer-related fatigue, and improve their quality of life during and after cancer treatment. And it's important to know, do they have a support system at home? Are they living alone? Are we their support system? The gym can be a community for them. They're going to meet people going through similar experiences. They're going to get a social interaction that might only be their only social interaction a day. And just to help them feel better, know they're safe, that they're doing what they can to help improve themselves. So this is kind of where we're headed next, right? How do we get involved? How can we make this happen? How can we help and be less than that 90% number? So one option is to partner with a cancer treatment center. Moffitt Cancer Center is really big here, and then Florida Cancer Specialists. Can we show them what we're doing, how we're changing people's lives already, and how important it is for cancer patients to have this rehabilitation starting right when they get their diagnosis, and how it can help improve their quality of life, decrease their medical bills, and then getting in contact with doctors for referrals for them to send their patients here. You have to kind of figure out, will insurance be able to cover it? How would that work, kind of thing. And then another way is to partner with the university to get funding. That's kind of where I worked before. It was partnered with the university, but there were also doctors that would refer their clients, their patients to the clinic.
Any university around here that does oncology or anything like that? Or has like cancer treatment?
I don't think so. I think it would be cool, like, to partner with an exercise science program and then to do it like that way. Like USF downtown or like Tampa, yeah. And then if you guys have any questions,
Okay.
that was it. I know I went through that kind of quick, but
Questions?
No questions. So a question for me, even though there's lots of benefits for exercise with cancer, have you seen anything where there's like a lot of potential risk, like during the exercise portion? Because obviously when you exercise, I'm assuming your heart rate's still going to increase, but if you also need treatment, I know you mentioned like more breaks and stuff, but is there anything where like you have to be extra cautious where it could be problematic?
Repeat the question so
oh.
we get the speaker.
Okay. So he asked, like, is there
Drawbacks?
yeah, is there risk of exercising during cancer treatment? And I would probably say no, as long as you're constantly communicating with them, making sure they're feeling okay, they're not dizzy. I mean, maybe they're feeling crappy that day and the only thing you do is bike 10 minutes and you talk to them the rest of the time, or you do a few stretches. It's good for them just to talk to you too. It doesn't always have to be, you don't always have to get everything done. It's just, yeah, so I would say no, just if you're paying attention to how they're feeling. I wouldn't see anything wrong with it.
That's good. That's good. Thank you. Awesome. Nice job.
Hey guys, thanks for watching our video. Make sure you share, subscribe, like, and comment below, and we'll try and answer any of your questions.